Sooner or later, a man who wins is the man who thinks he can. Hello everyone, this is Dr. Soumyadeep Datta. I have received a rank of 3 in this year's INI-CET May session 2022. For my success, I would principally thank my parents who are the pillars of my success. I wanted to become a doctor since I was in class 11, but my wish came down from when I was in class 6, when my father had a bypass surgery for a triple vessel block. From then only I wanted to become a cardiac surgeon, so I could not crack the NEETPG or the then called AIPMT at one go. So I actually went for joint entrance examination for the state, West Bengal. So I secured a rank of 67 and I joined Medical College and Hospital, Kolkata. So I enjoyed my college life a lot. It was a long journey of 5.5 years. The first 2 years of my college, or specifically first 2.5 years of my college, were very extensive. All the classes I did attend, all the practical classes and even the lectures that my professors used to take. So most of the basic fundamental understanding regarding the preclinical and the paraclinical subject came from what they taught to me. So I am definitely grateful for them. And coming to third part 1 and third part 2, these 2 years were again very important, not only because we need to learn many new things, but also because we need to revise the previous year's topic. And then came the dreaded year of COVID 2020. We had a break, we did not have so much class. So yeah, that was a set point when we used to be very much depressed about how to go about it, how to tackle the stress, and because there was a big interruption in the normal routine classes. And there were lots of support from our teachers. There were online classes that were arranged from the school also. We attended them as much as possible, and ultimately we gave the exam and everyone passed with flying colors. And then we entered into internship, the year where we get to learn the actual clinical hands. And in our college we had a lot of patient load, so it was a fortune to learn out of it. So my entire success would not have been possible without the contribution of my friends. Few friends whose name definitely I would take. Number 1 is Anurag Roy, number 2 is Arif Ahmed, number 3 is Soumyadeep Deb. So these 3 were my pillars, my strengths, my source of positivity during these 5 years, because they always encouraged me. Okay, they gave a positive vibe to me. They believed in me that yes, I can get a good rank. Yeah, so I've received many medals in my university. So I was the topper of all the 4 professional MBBS examination in my college, and I've received gold medals in many subjects, probably physiology and biochemistry the first year, all the 4 subjects of second and the fourth year, and community medicine and ENT in my third year. I've also received a gold medal in anatomy dissection, which we call here as Boschak Memorial. I was given a chance to dissect out pterygopalatine fossa right in my first year, so it was again a very great experience. And yeah, I have participated in many quizzes, and I've also achieved success in those. I had participated in the Indian Academy of Pediatrics quiz, Indian Academy of Pathology quiz that was arranged in AIIMS Bhopal. Although we could not make up to top 3, okay, we came out to be the 4th group out of all the 10 candidates that were selected in the quiz. So my DAMS family was there with me throughout these 5 years. I had joined DAMS right in my second year, and I started preparing notes, the self-written notes. I had attended the lectures that professors used to give. They used to come down to Kolkata by flight. We used to attend long classes of 12 hours in the auditorium. But yes, that paid off, because self-written notes are the most important. DAMS has given immense material to us, immense content to us that is actually needed for a candidate to appear in any of the competitive examinations at this level, because their protocol, their pro forma of putting everything into a place in a very compact manner, whether you say in the routine classes or in various formats like DAMS visual treat, that is the DVT, the famous TND of the DAMS, and even the new TNDs and the new courses that have come up in the online platform of eMedicoz. So everything that DAMS has given me is great, and probably if any Damsonian makes the best use of it, he or she can also get the success that he wanted. Everything that can be asked in the MCQ entrance examination has been covered extensively in DAMS through multiple resources, not only notes but also DVT, TND, all the grand tests, the subject-wise tests. So, okay, for getting the results, basically a candidate needs to follow a single source and has to revise, okay, from that multiple number of times, rather than, okay, being fickle-minded and going through multiple resources. So yes, DAMS has a very structured protocol of how they will present the entire content to the student, and you should follow that wholeheartedly, okay, for getting what you want. So all the faculty members of DAMS, my respectful teachers, they have always helped me out, even personally, and I will definitely take name is Rajiv Shatisha of PSM. He came down to Kolkata and he personally contacted me. I was in his class and he had a very good interaction. He had supported me every time. Whenever I had a doubt, I used to text him and immediately he used to answer me. And needless to say, Deepti ma'am and Sethi sir, he and she has been my second father and mother. I had already told that in my yesterday's interview. And yeah, it was a great experience studying from them all. And definitely I will also take the name of Surya sir and Partho sir of microbiology, who had made the entire thing very interesting. With due respect to all my teachers, because of you only I am here today. So when DAMS had initially started the online classes in the year of 2020 of COVID, so I felt a bit difficult to follow the classes because we had to look into the computer screen or the laptop screen for long hours of 8 to 10 hours a day. But gradually we coped up with it well, because at that time we used to sit back home, so we got a lot of time to revise what was taught in the class the same day. So and even the content that DAMS had provided during that year was a little bit more high yielding topics, and that extra edge we got in that year, which was not routinely covered in the normal face-to-face classes. So basically the initial problem of looking into the screens actually turned into a great deal at the end, because we landed up writing more notes and the content became much more enriched. So it helped us actually for the examination. So I would like to owe my success to my parents, my mother and my father. In these 5 years I used to stay with my father at Kolkata only. My mother used to live in Durgapur for a walk, but she came down to me whenever possible during the holidays or during my routine college days. In the weekends I used to go to Durgapur also. But yes, everything, the entire path which seemed very difficult in the beginning, it became easy because of them. My father always used to tell me that be consistent in your efforts, because what matters at the end is the positive effort you give, the honest and disciplined path you take. My mother always supported me by being here physically or over phone, that do not take extra stress, be the person you are, be the boy you are, and give your best and leave everything up to God.
This is perhaps the most happiest moment in my life. किसी भी चीज़ करने के लिए ना हर चीज़, हर क्षेत्र में एक प्रोटोकॉल फॉलो करने का ज़रूरत है, और वो प्रोटोकॉल आता है गाइडेंस से. If you don't have a guide, if you don't have a proper guide, you can't understand the protocol of things. You can be hyper intelligent, but you have to understand how to prepare, what to study, when to study, and how to get prepared for the show. इसके लिए आपका DAMS जैसा इंस्टीट्यूशन, इसका जो इम्पोर्टेंस है, that is the most important thing, because until and unless you have a proper guide, DAMS gave him this guidance, and touchwood, from day one he followed whatever DAMS has taught. He followed whatever Deepti ma'am, Sethi sir and other faculties have taught him or guided him, and we also inspired him to follow only one particular path. इधर उधर ढूंढ के आप confused हो जाएंगे, and for that reason he followed DAMS and he took DAMS as his family.
So as we all know that this examination, INI-CET, is very unpredictable. You do not know that what questions they will throw to you. So basically you need to have a very planned and charted path of how to tackle those questions. The first thing that DAMS has provided beautifully is the previous year's question papers along with their solutions in a single platform of eMedicoz, and they have also recently introduced the video solutions of all those previously asked questions. Along with that, DAMS has also brought out the INI-CET TND specifically for this examination. So whatever you take, whichever course you do, basically you need to follow DAMS, a single source in detail from top to bottom in depth. because then only you will be able to understand that every question that has been asked to you even in this year's INI-CET was linked to some topic or the other, and you will get to know this only when you move into the depths of the content that has been given to you by DAMS already. So after giving this year's INI-CET, I was pretty sure that I would get a good rank. I expected to be in the top 10. Definitely no one thinks to be in the first in the top 3 rank because it's very unpredictable. But yes, I could have given the exam a bit more merrier because I had made silly mistakes because of the examination pressure, you know. There are a lot of environmental stresses. You see so many competitors around you, and even on the day of the examination anything can happen. So the most important thing for any INI-CET exam, to be specific, or any competitive entrance examination in general, you have to stay calm, you have to be happy, you have to enjoy what you are doing, and definitely you will get the result. So I want to pursue MS in general surgery from AIIMS New Delhi. So I have made up my mind for the time being. I do not know if this will change. Definitely I have to consult all my respected teachers. I will attend the DAMS career counseling. They will give me better advices regarding it. But I have a passion for surgery, so I wish to take it up in the apex institute of the country. I would like to mention about the eMedicoz app, which DAMS has evolved in these years, because it's a single platform where all the online content of DAMS has been placed, whether it's the courses of DVT, the TND, all the test series, within that the grand tests, the subject-wise tests, and even the CBTs, okay, which one used to miss in the routine centers, they were uploaded later in the application. So yeah, it was a great app, and the most, again, a very unique feature of this app was there was a daily quiz of 5 questions, which brought again an extra edge, because in the last few days before the examination there were difficult questions being put, not in sense of new topics, but yes, again the same topics being placed in a different and a more conceptual way. So I used the app to my best as much as I could, and I think that every Damsonian should use it whenever possible, because it's very student friendly. You can download it in any of the iPad or even on your phone. You can use that whenever you're traveling by during whether it's by bus or by metro, and even in your college when you're free during your internship. So it will help you to have a wholesome idea of all the different subjects. Probably, okay, suppose I did dermatology extensively from eMedicoz app because I thought that I was weak in it, and even anesthesiology. So basically you can pick up subjects which you are weak at. You can create custom modules. There are different features that DAMS has evolved in the app itself, so you can make the best use of them. And I think that following a single source, for my case it was DAMS, helped me a lot, and it was the only reason that I am here today at rank 3, because consistency will matter at the last. And yeah, it's always important that you have a content, but content without any reason, content that will not matter to you much in the examination, doesn't matter. So the most important thing I would like to mention about DAMS, that I do not know how, but all the teachers have a very high prediction rate of what can come in the examination, and I was really surprised while giving this INI-CET that how it came, that the direct questions from notes, the same thing I studied in anatomy the previous day night, the same exact language, same question was put in the INI-CET screen. I would like to share with my juniors that for achieving any success in life, not only for the entrance examination but anywhere you go in life, is smart work. In this case it would be smart studying by either making notes, clearing your concepts and revising. Number 2 is practice. Practice is very important because it will help you to understand the actual game scenario, because during the examination you will have immense stress. Once you start giving the grand tests at your home, these 180 minutes will definitely fetch you good results in the actual examination, because you will learn to cope up with this stress. It's always advisable to go to centers and give the computer-based tests that DAMS conduct, because that will give you again an extra edge to handle the examination stress scenario.